want to welcome our first guest, Dr. Michael Forbes, Chief Academic Officer, Akron Children's Hospital. Dr. Forbes, can you share with us, from your perspective, why this RSV shot is so important and why you're confident in its safety?
Sure. Thank you, Dr. Vanderhoff, for the invitation and opportunity to share and talk about this. I do want to spend just a few seconds thanking all the families who participated in the clinical trials that allowed us to get to this point. As a pediatrician and as a pediatric ICU doctor, I have seen the worst versions of RSV, where it's either life-changing, life-threatening, or even resulted in loss of life. And so this is actually a historic moment for us in pediatrics. RSV, as you mentioned, accounts for a lot of the disease that we see, particularly in infants in the first year of life. So we're grateful for the development of nirsevimab and the FDA approval. The vaccine was approved by the FDA after 3 major clinical trials. 2 were safety efficacy focused. 1 was a randomized control trial comparing nirsevimab to palivizumab, which is a drug we've had for over 25 years that helps us reduce the risk of hospitalization due to RSV. All 3 of the studies include safety measurements, and the good news is the safety profile for the drug is very, very favorable. The most common reported safety effects or safety related events were local inflammation at the injection site. A few children did develop rashes. They also developed it in the placebo group, for what it's worth. And there are very rare side effects associated with monoclonal vaccines or monoclonal treatment. Related to a very high sensitivity to the monoclonal antibody, where your immune system either attacks the antibody or your immune system can attack other parts of your body. Very, very, very rare. And I'm aware of 1 report in all of those studies of what's called heparin-induced thrombocytopenia that may or may not be related to the vaccine. So very safe, highly effective. It reduces the chances of, or the risk of a medically attended RSV-related encounter by about 70% overall, and reduces hospitalization by almost 75%. So a real game changer for us in this area.
Dr. Forbes, this is certainly terrific news for children and for the parents of children and the families that love them. But, I think it also highlights just how important childhood vaccinations are generally. Can you tell us a little bit about what other shots kids need and why parents need to really continue making them a priority for preventing diseases that have been a problem for previous generations?
Yeah, no question. I think that for us in pediatrics, we focus on prevention. We will admit that we're a part of a sick care system. The system historically has been developed to focus on what I do and others in critical care and emergency medicine. But the fact is that that's really probably not the way to move forward. And so we focused on prevention. And so we advocate helmets and seatbelts and vaccines. And so the focus on preventing what's preventable is really what this is all about. Before 8 months of life, we expect children to receive really a raft of vaccines, as many parents are aware, including hepatitis B vaccine, pneumococcal vaccine, DTaP, MMR, really a host of vaccines recommended by the AAP. In addition, as we're heading into this, school's about to start or has started for some people, and we're entering into fall and winter, we can't emphasize any more the importance of getting that flu vaccine as well. And finally, as you've already alluded to, I think we have to make sure that we're protected whenever possible against COVID. It's still around. And while for many people, flu and RSV and even COVID can be annoying, a cold, for some people, it is life-changing or life-threatening. So if you can prevent that, I really, really encourage you to just prevent that so you can keep living your life the way you want to.
Thank you so very much, Dr. Forbes.